Hi, my name is Dr. Barton Bishop, and I'm a physical therapist and Chief Clinical Officer of Sport and Spine Rehab in the Washington, D.C. region. We have a multi-location, multi-specialty clinic of chiropractors and physical therapists and treat athletes and non-athletes alike. I myself am a board-certified sports clinical specialist by the American Board of Physical Therapy Specialties and have been using Thera-Band products for many years. One of their newest products is the Thera-Band shoulder pulley. Right away you can tell that this pulley is a Thera-Band product because of the colors. I love that about Thera-Band. You can also accurately and easily assess patient progress and patient progression using the marks on the rope. So I am able to determine if a patient improved from yesterday to today when I see that they've moved from Mark 1 into Mark 2.
Hi everybody, my name is Dr. Jay Greenstein and I am founder and CEO of Sport and Spine Rehab, a multi-location, multidisciplinary practice right outside of Washington, D.C. I've been using Thera-Band products for many, many years, including when I treated athletes at the 2008 Beijing Summer Olympics. One of the newest products from Thera-Band is the Thera-Band shoulder pulley. Right away you can tell this is a Thera-Band product because you can see the Thera-Band colors. An important thing to note about this product is that it can be used for many, many body parts, upper extremity and thoracic and lumbar spines. One of the many things I like about the Thera-Band shoulder pulley is that it has specific marks that can assess patient progress and range of motion and flexibility. Also very important that you can document this progress in your daily soap notes. So one of the many important product features, in addition to the marks that are on the rope that mark progress for patients, is the Doorstop, which can be used both above and to the side of the door. Today, we're going to talk about using the Doorstop in the side to do a thoracic spine stretch. So in order to position the patient correctly, the patient will take one of the handles in the right hand, one of the handles in the left hand, and we will position the patient where their feet are shoulder width apart, the right arm is fully extended, and the left arm is mid-sagittal. What we want to do here is make sure that the patient has stabilized their hips and that only the thoracic spine rotates. So Anna, what I'm going to ask you to do is pull with your right arm towards your body and allow the left arm to go across your body and feel the stretch. One of the most important things we can do now is tell her that she's gotten to the first mark and to expect to make future progress on future visits in order to get to the second mark for full thoracic rotation. As we can see, the beginning position of this exercise does not necessarily correspond to the middle position of the pulley. As the patient progresses through her range of motion during this exercise, what we're looking for is a progression through the marks. Now, she gets to this mark today, and we will anticipate that in future visits, she will get to this mark between these two regions. We also know that between the two marks of this region, every 6 inches is about 20 degrees of thoracic spine rotation. We can document that progress for the patient and also know that this patient is responding adequately to this particular exercise.
So what we are demonstrating here is shoulder external rotation using the Thera-Band shoulder pulley. What you notice is that the left elbow is locked at the side as the right arm pulls the left shoulder into external rotation. It is important that the rope and pulley stay oriented in the horizontal plane, with the door anchor being anchored in the door at the waist or elbow height. So what we're demonstrating now is standing shoulder flexion. What you notice is this would be a patient that is an early post-operative patient where we're trying to limit the amount of shoulder flexion that the patient can do and just achieve gentle range of motion. We can use the marks on the rope to gauge how far the patient can go. In addition, the patient can take this home and be able to dose their exercise appropriately without hurting themselves. We are now demonstrating standing shoulder abduction. Just like with shoulder flexion, this would be for a patient who is early post-operative, where we are limiting the amount of shoulder abduction the patient can do. We are able to use the marks on the rope and pulley in order to determine how far the patient should progress in this exercise. We are now going to demonstrate sitting shoulder flexion exercise using the Thera-Band shoulder pulley. It is important to keep the elbows straight in front of the body and the palms facing each other as the patient goes through this motion. This motion can be used for active range of motion as a warm-up, or it could be used for stretching to increase shoulder flexion in a patient who is restricted from adhesive capsulitis or post-surgically. Notice once again that we can use the mark on the rope in order to determine patient progress and to show that patients do improve. We are now demonstrating shoulder abduction using the Thera-Band shoulder pulley. It is important that the patient keeps their palms facing downward and their arms in the plane of the body. During this exercise, we can use the marks to gauge patient progress and to demonstrate to patients that they have made improvement with care. This is active assistive shoulder internal rotation using the Thera-Band shoulder pulley. It is important to keep, in this case, the right hand on the spine, running directly up the spine as the left hand pulls it up. This helps to increase shoulder internal rotation on the right side. This is shoulder extension using the Thera-Band shoulder pulley. What you notice is that Anna is keeping her left arm straight as she's using her right arm pulling down to increase the amount of shoulder extension that she has. The door anchor allows us to conveniently and securely attach the Thera-Band shoulder pulley to both the top of the door and anywhere along the side of the door that fits the exercise that you prescribed.